2 weeks prior, I was really feeling tired. I was really feeling fatigued and exhausted. I felt pain in my jaw on the left side and tingling in my left arm. I didn't want to die. I had never heard anyone survive. I told y'all something was wrong.
Thank you so much for deciding to come on and have a talk with me today, Dr. ShantaQuilette. I am truly honored. And I know that we've gone over this a little bit on the side, but if you don't mind, could you please introduce yourself?
Hey y'all, hi everybody, and thank you so much, Megan, for inviting me today. I'm also honored, and the pleasure is mine. I am Dr. ShantaQuilette Develle Carter Williams. I am a digital entertainer, nationally recognized heart advocate, stroke and heart attack thriver, and women's wellness coach. I'm an advocate for all things health, and I'm so grateful to be here again to share this platform with you.
So what were you diagnosed with and what age did it occur?
So I was diagnosed with a number of things. I went about 8 years being misdiagnosed,
Oh,
uh,
wow.
but ultimately I was diagnosed with a condition called ASCVD. I always have a hard time pronouncing that word, but it's atherosclerotic cardiovascular.
Atherosclerosis.
Yes, girl, listen, what is it? Supercalifragilisticexpialidocious.
Espialidocious.
That's one of them words. But yeah, of course, where plaque builds up on the arteries, and so I did not know that I had the LPA biomarker till here recently.
Mhm.
But yeah, so I was diagnosed with ASCVD, and then also exercise-induced cardiac arrhythmia.
So you talked about like the specific biomarker. I didn't get it, but what exactly is that biomarker?
It's related to your cholesterol.
Hmm.
And so it's the bad LDL. And so basically it's genetic. You can't cure it. So the thing is, this entire time of me being diagnosed, I really thought it was something that I could reverse, right? Having cardiovascular disease, you eat right, you lose weight. And the goal is to prevent another cardiac occurrence. And so the LPA biomarker increases your risk of having a cardiovascular event, which I've already had.
Wow. And is that something that you can like request in your doctor's office to check for, or is it
Yeah, it's
something?
not routine. It's definitely not routine. It's not a routine test. I actually looked up and got the test, actually working with an organization through a influencer marketing campaign,
Mhm.
where they provide the test for free, but it was not something that my doctor offered me. I was actually able to take those test results to my doctor and get another health plan versus the one that I was on before. So I was able to increase the dosage of my medication. Right now, they are working on clinical trials for this particular condition, but right now there's really nothing to support it other than the regular medications that I had been on.
So, leading up to you getting the diagnosis, because you talked about ASCVD, you talked about having an arrhythmia, like what were the symptoms or any signs that like you experienced? Because I know, especially with like people of color, sometimes things could present a little bit differently, and you could just easily brush it off and ignore it. So, what are some things that kind of stood out to you?
Yeah, I felt off. I felt off. I always say not like my wig sliding off, but my body was not cooperating with me. So one of the things that stood out, especially for the heart attack, was 2 weeks prior. I was really feeling tired. I was really feeling fatigued and exhausted, and it stood out like they say like a sore. It stood out like a sore. And in between those 2 weeks, I started feeling like flu-like symptoms. So I felt like I had a little heaviness in my chest. stiffness in my neck, all the way up to the day of my heart attack, where I felt pain in my jaw on the left side and tingling in my left arm. But within those 2 weeks, I was feeling pain on both sides. It wasn't the atypical symptoms that you see men get. So it wasn't like I was like, when you think of heart attack, you think of like sharp pain. You see the man on TV, he's like, ah, it was none of that. It felt just like me coming down with the flu.
So in that period, were you prompted to go into the doctor or
So,
like,
so here's the thing. So I have been gaslit for about, approximately 7 to 8 years by my doctor, by my cardiologist, and being told that it was stress, right? It was related to stress. I was doing too much, and at that time, I had increased in size, so I wasn't at a healthy weight. So all of these things were like co-contributors to my symptoms, according to my doctor. And even though I felt like it was something more, I really didn't challenge those assumptions because I can say that I was somewhat intimidated by my doctor. He's a doctor, right? He went to school
yeah.
8 years. He went to school 8 years for this. So who am I to challenge those assumptions? And so uh yeah, so I pretty much, I advocated for myself. I went to the doctor back and forth, went to the emergency room. But the doctors said it wasn't that serious, and in actuality, it was. And so up until the time that I had to go to the hospital, I really started taking an approach like my doctor. I started dismissing my symptoms. I started dismissing my symptoms, and I decided that I had the flu. And I'm grateful that I had my husband, who is an advocate of me, and he did challenge those assumptions and encouraged me to go to the hospital. And my daughter ended up taking me to the hospital that day. And I was diagnosed with a myocardial infarction. So, yeah.
When you finally got that diagnosis, like what was going through your mind? How did you feel?
So here's the thing. The first thing I felt was a heavy weight. I felt like a heavy weight. I felt death. I felt my mortality. I started facing my mortality right then and there in that moment. I have children. I'm young, and so uh, I didn't want to die because that's what you hear. I had never heard anyone survive a heart attack. The individuals that I knew in my family who had had heart attacks, they are no longer with us. And so I was scared. I was scared. I was frustrated. I felt like if I died, my tombstone would read, "I told y'all something was wrong." That's what I felt in that moment. It was just betrayal, it was frustration, and it was sadness.
I'm sorry.
It's all good, girl. I'm here.
I'm sorry for that. Um,
Thank you.
After that, like what was treatment like for you? Like,
Oh gosh. So you think about, so you hear this story and you think, okay, she went to the hospital, she got diagnosed, now she's on a treatment plan and life's fine and dandy. That did not occur. The situation escalated, right? So I was under the care of a physician, a cardiac physician, who also was the resident physician at the time I was admitted to the hospital for my heart attack. And he was not an advocate of me. And so he quickly dismissed my situation and immediately put the blame on me, as far as, "I told you you were stressed, I told you you were overweight." And the thing was, it wasn't only that he did this to me, he did this in front of my family. So now he is creating an additional situation because he's a doctor. My family, in some form or another, may or may not think that I'm doing too much. So basically, the doctor is really coming and co-signing on what their assumption is already of what's going on. And so I was told that I didn't have any damage to my heart, right? But I also feel like the amount of testing that was done was minimal. And at that time, more could have been done. My blood pressure was high. I was not given a treatment plan that uh, had medication, so I didn't get any medication. I was just basically put on the Mediterranean diet and really given um, some basic rules to adhere to as far as my treatment was concerned and to mitigate the symptoms that I had. And that was basically what my doctor said was what he suggested was quitting my job, which was not, uh something that was feasible at the time, right? You can't just tell
Yeah.
somebody their good government job. And so I did go to work and work with my employer to provide me a reasonable accommodation, which they did. They provided the reasonable accommodation that seemed to like minimize my situation or minimize the symptoms that I was having. But then later on, throughout the next 9 months, I would have symptoms. I would have headaches. I would have, chest pain. I would have all these symptoms, and ultimately went to the emergency room by ambulance in February because my heart attack was in 2018, June of 2018, and then I had the stroke in April of 2019. So in between that time, I was back and forth to the emergency room, back and forth with a neurologist because I was having migraines and I was just having all the things, and finally got to ER ER physician who was like, "Hey, I think you need to fire your doctor."
Wow.
So that was the first part of, following up on my intuition, right? And having somebody else come in and stand in and be the voice for me, like, "Hey, I don't think this doctor may be the best doctor for you. Let's see if we can find you another doctor." And that happened, and I immediately got that doctor, and he appeared to be on my side and recognized that I had a heart murmur, recognized that there was some issues going on, and scheduled me for a heart cath. I got set up for a heart cath, and in between that, blood pressure was high. This is such a long story. I try to break it down as
Yeah.
short as I can, but it is very long.
Yeah.
But just to make a long story short, I went to, ended up going to that cardiologist, getting a heart cath, finding that there wasn't, any damage in my heart. He was really thinking that it was stress that was causing the palpitation. It was almost insinuated that it was just all in my head, that basically I was crazy. And ended up going to a pulmonologist uh at the referral of my at the request of my cousin, who was also having some of the same issues. I went to the pulmonologist. He found that I had a mild tricuspid regurgitation, and I ended up going to him. He suggested, that I get tested for sleep apnea because that could be also uh, a a reason why I was having the issues that I was having. I ended up going to him around April 6th, went into the office, major swelling in my leg. I was asked what that meant. They said it could be my heart. Then he said, in that conversation, I was like, "Well, I thought you said there was nothing really wrong with my heart." And he was like, "Yeah, that's right. Let's put you on some water pills." Followed up with my cardiologist on the 8th, who, basically said everything looked good. I still needed to monitor my heart rate when exercising. I asked him about that tricuspid regurgitation. He was baffled that I mentioned it and was like, "How do you even know that you have this?" And I was like, "Well, I had an echocardiogram after you left the hospital, and I ended up staying in the hospital 2 more days." Why he didn't know that, I don't know. But I was discharged. I was set up for an appointment to get the a procedure to allow my heart and blood to flow better because basically the tricuspid was like a pinching valve, like it was a little pinching valve, and basically said they could go into the heart and fix that, or they could do a non-invasive procedure. And I was excited. I was really excited because this was the first time that I felt like, even though there was some part of me that was like, felt like something was still wrong, but there was another part of me that was in denial and didn't want anything to be wrong. So the information that the doctor was giving me, it coincided with where I wanted my life to go at the moment. I just wanted everything. I just wanted a sense of normalcy, right? I did not want to be worried about sickness. I
Yeah.
didn't want to be worried about sickness. I just wanted to be well and have a decent quality of life. And the next day, me wanting a decent quality of life, me basically ignoring the assumptions and ignoring my intuition, it came to pass because I went to work the next day on April 9th around 7 a.m. and had a stroke. I
Wow.
was rushed to the hospital, and they told me that at that time they didn't tell me I had a stroke, but me, I was, barely 40 years old. I'm young, I'm vibrant, I got all my edges. I don't smoke, and I still had a lot of plans and still had a lot of dreams and still had a lot of bills, right? And so you never think that that's how you can never prepare for what I had to prepare for emotionally, financially, physically. You can't prepare for it. Your family can't prepare for it.
I know you started going into this a little bit, and you said that your life like was changed in a lot of different ways. So how did this diagnosis affect you financially?
Oh, well, I had insurance, right? So I
Hmm.
had insurance. But we were two income household.
Yeah.
And those hospital bills, medication, copays, copays that I didn't have before. So now I have a new set of doctors, right? So I have a new set of doctors. I have a whole bunch of unexpected expenses. I can't work, right? I can't work. Great thing about my job is that we have like an annual leave program. So there was only like a few weeks that I went without getting paid up until the time that I retired. But there was unexpected expenses that I didn't have before.
Mhm.
So not only did I have a new set of expenses, I also felt like a part of my life. I did feel like a part of my life was taken away from me because I love my job. I love my job. I loved everything that I did, and it provided me a really great lifestyle.
Yeah.
It provided me and my husband a really great lifestyle. Like I said, I was able, my husband, paid all the bills. He paid all the main bills. But as far as like us being able, us traveling and me providing for the kids and them being part of activities, we were able to do those things in access because we did have a two income household, right? A thriving household, a thriving household financially. And you can't plan for that to just stop, right? And then you don't plan for, like, we had savings and things like that, but there was a lot of unexpected expenses. Then you're not only factoring in me coming away from work, my husband had to step away from work, right? So now he's leaving and he's exhausting his leave because he has to take care of me. And so uh now when you're not making up for the income that you're not receiving at work, now you have to dive into your net
Saving.
savings, right? And
Hmm.
so now that's dwindling down, right? And so it's a situation that most people don't talk about, right? It was just like, it's like, if I could describe it, it's like getting an invoice for a mortgage on a house you don't live in. There were costs that weren't covered, right? Uh the holistic treatments I needed, going to my therapist and going to my psychiatrist, the therapy both physical and emotional, the home modifications,
Oh, wow.
it's the Uber rides, because driving was no longer an option sometimes. And sometimes I had to get to places when there was nobody at that right time to take me. Like, I might want to go to the grocery store. My husband might be at work and I may not want to wait for him to get off of work. But that's what financial toxicity is,
Hmm.
the cost of staying alive becomes its own illness. And we don't talk about, I was just recently in Switzerland. I was talking to a gentleman and he was just talking about how it affects Black people more.
Yes.
And a lot of us are surviving, but not a lot of us are thriving. The system makes you feel like you have to be grateful for just being alive, while they continually rip your pockets to shreds. If that's just me talking, it's just like they quietly bankrupt you. I hear these stories. I heard these stories through when I was, operating my nonprofit in full capacity. You have to make decisions whether to buy your medication or give your kids lunch money, you know, or do I have to call my mortgage company and ask for an extension so I can take my medication?
Do you think that financial toxicity can be fixed?
I think so. It's up to our healthcare system to do so. You think about what Congress is fighting right now. They're basically fighting to take away what we barely have now, right?
Yeah.
And at the same time, when you are me as a federal employee, probably have some of the best insurance out there, right?
Yes.
And it could be better. But then you have people who have access to the best care, to the best practitioners, probably for their existence, will have top tier medical care.
Yeah,
But you're fighting for me not to have that. Make that make sense.
that's true.
Can it get better? Absolutely. Anything can get better. I believe anything can be fixed. But it takes the right people being in office and the right people to fight for the equity of better health for that to happen. Your health shouldn't bankrupt you. It shouldn't.
Well, Dr. Shanta, we are going to pause here. I will see you soon. Don't go anywhere. We have more about financial toxicity in healthcare after this. Last time when we had our previous conversation, we got the opportunity to learn more about your journey to your diagnosis. You talked about like the relief that you felt when you were finally able to get your diagnosis because you had that gut feeling for a very long time. But then you also started shedding a little bit of light on into the reality of treatment that was associated with having a stroke and a heart attack. So this time we're going to dive a little bit deeper into the financial aspects of those diseases.
Yes.
So, do you have a rough estimate of how much your treatment costs for your heart attack and your stroke and either or? And are you aware of like the percentage that you were required to cover out of pocket and what your insurance had to cover for you guys?
Yeah. So actually, to be honest, my most of my insurance covered my treatment with my heart attack, my physical therapy, occupational therapy. The most that I paid was a $40 copay
Oh, wow.
during each visit. So I am grateful that I have insurance that was able to cover me during that time.
Wow. So like, I mean, if you don't mind sharing, like, do you know like the type of insurance that you selected that gave you
Yeah, I have
such a
Blue
good
Cross.
coverage?
Yeah, I have Blue Cross, Blue Shield, PPO, Federal.
Oh, okay. So you were a federal employee.
Yes.
Oh, okay, okay. So the goal is to become a federal employee.
Yeah, listen, I guess maybe in another few years.
Oh, okay. So like in terms of that, were there any like extra? Because I know with like a stroke and a heart attack, sometimes you have some tests, right, that are not like
Yeah,
regular tests that your doctor would recommend. Did you have any issues with those being covered as well, or was everything like taken care of?
everything, thanks. That's a great question. Everything was pretty much taken care of. However, because my treatment was reoccurring and the amount of times that I had to go to different specialist, those dollars started to add up. So when you think about going to a neurologist
Hmm.
every single month for 2 years, going to a cardiologist every single month, uh, getting, different exams, different tests, different MRIs, it's $40 every time I went to see one of those specialists. So you're looking maybe at $200 to $300 a month each time I had a visit. Also with physical therapy, there was still a copay. So I was going to physical therapy almost 2 years and I was going 4 days a week. The great thing is during those visits that I was having with those specialists, the occupational, physical, and cognitive behavioral therapy, they were all in the same day. So that $40 included all those
Oh,
specialists on each
wow.
visit. Yeah.
Okay, wow, that is amazing.
Yeah, but you're thinking $40 a day, so I'm thinking maybe $160 a week I was paying, for my physical therapy.
Oh, wow. And
Yeah.
then during that time, because I don't remember if we like really dive deeper into this while on the last episode. So during that time when you had like the physical therapy and everything, so were you still able to maintain like your full-time job? Or did you have a situation whereby you were allowed to like work from home or like a hybrid schedule or like stuff
Yeah.
like
So it was like a hybrid schedule, but it was normally I was working against my doctor's orders just so I could feel like I was doing something. I think I told you earlier that I was completely in denial after my stroke and was dealing with a lot of emotional and mental um uh I won't say issues, but there were some challenges. I had some mental and emotional challenges just going through that whole transformation. So I remember asking my doctor if I could work a few hours. I was an IRS revenue officer, so
that?
my job consisted of casework, right? So I had consistent casework, uh, looking up files, trying to meet deadlines. So to appease me, my job allowed me to come a few hours out the week to work. Outside of that, I think there was probably about a month that I didn't have any income because I didn't have any leave because I had used all of it due to my sickness. And so what was great about working for the federal government is that they have leave programs and voluntary leave programs where you actually donate leave on a monthly basis.
Hmm.
And that way, when you do need to use the leave, you can actually go and use it, or you can reach out to different employees within the government, any agency, and there's a lot of agencies within the government. They send out emails and let them know that there is an employee who actually has exhausted their leave and they need leave. And so those employees have the option to donate. And it was great
Oh,
because I
wow.
had friends. Yeah, it was really great because I had friends that were in the government. My husband was in the government, most of his friends work in the government. So they were able to donate leave to me. And so out of the 2 years that I was outside of work, I really didn't have to worry about not having a paycheck other than a month out of
Oh,
those two
wow.
years.
That is amazing. That's
Yeah.
honestly really amazing to hear. Like I know people have always talked about like getting a job in the federal government,
Yeah, it's
but
like the dream, like what they say, the American dream is to get you a good government job. Like my uncle, my grandfather, my great grandfather was either get a government job or become a nurse.
Yeah, but it's like I feel like what tops a nurse is probably getting a government job because it
Yeah.
seems like there are a
Or
lot
being
of
a nurse
like
in the government.
yes, be a nurse in the government because it seems like there's so many things in place to assist you, like just in case something happens, and even like
Yeah.
having the opportunity for friends to like donate their extra like leave or PTO time to you. Like I have never heard about that, but that is
Yeah,
amazing.
it is a great program within the government.
In that case, were there any like health resources or organizations that you utilized to assist you during this time period?
In the beginning, there wasn't, I feel like when I first had my stroke, I was kind of on my own outside of, my spouse and my children who live with me,
Yeah.
but I was never given any like resources or told to be able to outsource assistance. It was me actually doing my own research
Mhm.
and going to events where I found a place where I could find other patients who were experiencing the same things that I was going through to have an outlet. And that was just, just through research. Oh, they're having an American Heart Association is having an event. And so through American Heart Associations and other organizations that were related to women's cardiovascular disease, I was able to find a tribe. And within that tribe, I was able to find other resources, and that's how essentially I became a patient advocate.
How do you think that your experience would have been different if you gained knowledge about these organizations and resources from your doctor's office?
I will actually say it would be better because I didn't have an understanding of what I was going through, so I felt isolated and alone.
Mhm.
And had I been able to talk to somebody where I wouldn't have to shed those extra layers off to explain what was going on or what I was going through, it probably would have been easier for me to grasp what was going on early on versus later, which stunted my recovery because I was so eager to go back to work and so eager to get back to this sense of normalcy, which no longer existed because I was chasing a person that no longer existed. I think I think I would have recovered sooner. But because I didn't do that and I was trying to go back to work and I was trying to pretend that I was better, it actually extended the amount of recovery that I needed because I was taken out of recovery for a while and had to go back into recovery because I was still having episodes where I was falling or I had extreme brain fog, just a lot of different post-stroke symptoms I was experiencing.
I know like they always talk about one thing I've heard that they say is so important in the recovery process, in addition to like your treatment and finances and your mental health, is a support
Absolutely. Absolutely.
system. And
Yeah.
so here you're talking about the benefits of having a community that understands exactly what you're going through and can actually break it down to you that in as much as you desire to go back to
Right.
being the Dr. ShantaQuilette that you were and working and living the life that you were living before the stroke, it's like this is the reality of that and helping you see things from a different perspective.
Absolutely.
So when would you like recommend that like those conversations are had after your diagnosis?
I think so. The minute you can have the conversation, depending on the severity of your situation,
Yeah.
it's going to depend on that, right? But once you are, I guess, you're in a sound mind, I think you
Yeah.
should discuss it immediately. I think just like recovery, I think the outcome of immediate recovery, I mean of immediate assistance, proves for a better outcome. So when I had my stroke, I went into rehabilitation immediately, like from day one, and that's also going to be it's going to matter on it's your insurance and your ability to pay is going to matter, right? how soon you get in how soon you get into a doctor, how soon you get into rehabilitation, how long you stay in how long you stay in rehabilitation is going to matter. Because I know a lot of people that say, well, I wasn't able to afford rehabilitation. I wasn't able to afford the co-pays. I hear this from patients all the time, or caregivers of patients, about their experience when it comes to post-stroke recovery. But I would say immediately, I think the conversation, as soon as you're able to sit down and talk to your doctor about rehabilitation, outsourcing community is important.
Changing things a little bit, what skill sets did you have to develop to enable your accessibility to healthcare like resources or the healthcare system in general following your diagnosis?
Like what skill set?
Yeah.
I don't think I necessarily had to have a skill set, more so a desire,
Okay.
more so of a desire to get better and to get well and to be in a place that I truly understood what was going on. I think, like I said in the beginning, I didn't understand that. I was in a really dark place because you can't prepare for a stroke, right? You
Yeah.
can't prepare for a heart attack. Uh, So it happened one day, and then the next day I'm not at work. The next day they're telling me I can't go back to work. I'm not able to walk. I'm not able to communicate. I'm thinking differently. It has a huge impact on you, not only physically, mentally, and emotionally. And so all of those things have to be unpacked and dealt with individually.
Okay.
And so it's really hard to say what skill set you need when your mindset is not even prepared for what has happened. And
Okay.
so, if anything, I would say is to make sure that you have a great set of practitioners on your side that can help you navigate through those things. I had an amazing neurologist who got me a neuropsychologist, who got me a psychiatrist, who got me into therapy and also made the decision to transition me out of different programs. Like I went to one program to another. And when I first went into recovery, I was at a facility that only dealt with occupational and physical therapy. I wasn't immediately dealing with the cognitive and the speech side. And so she was able to find a comprehensive program after me going to two different facilities that actually did everything, and I was able to go at one time, and it also benefited my husband as well because he was also working. So he's my caregiver. He's also having to go back and forth to work. So having to, schedule appointments at different times with different doctors on different days, it just wasn't fathomable for either of us. And so to be able to have a care team in one place that I was able to go daily, because again, I was going every day, 4 days a week. I was going 4 days a week for
Yeah.
3 to 4 hours a day for almost 2 years.
Now that you talk about that, I know that in the previous episode, you shared on like having to basically fire your old practitioner and
Absolutely.
get a new practitioner. So, what features can you tell people to look out for signs of like a good practitioner versus someone that is not a good practitioner?
Yeah, and so you are essentially the CEO of your health, and I call your doctors your worker bees. Those are your employees; they work for you, and you think of yourself as a CEO, but you also think of yourself as an internal HR.
Yeah.
And so, as we are what is it scored through our employer, that's the same thing you do your doctor. You want an employer that listens to you, understands you, uh receives your grievances, hears your voice and not dismiss you, not make you feel like you don't know what you're talking about. A doctor that takes initiative and works immediately when it comes to your frustrations or your health. You know your body better than anybody. So when you tell a doctor this is going on, I expect my doctor to move immediately. Whether he can do it or not, he outsources those different things, whether it's, sending me to a different type of practitioner, a cardiologist, especially if you're going to your PCP, your primary care physician,
Mhm.
you want them to be able to outsource you to a cardiologist or a neurologist or a rheumatologist when certain things or certain um, symptoms occur, especially if they don't understand. And it's okay to challenge the doctor's assumptions. It's okay to ask questions. And at any time you don't feel comfortable with your doctor, it's okay to find you another doctor. I think it's really important. I think that was one of the things that I didn't do immediately is move on from the doctor. I trusted what my doctor said more than I trusted myself. And it became almost how my doctor made me feel. I was almost intimidated. There was a point in time that he asked me, "You're an accountant, right?" When I tried to challenge some of his assumptions or come up with some different suggestions or maybe even self-diagnose myself to say, "Hey, can we look at this? This sounds like what I'm going through." And he was like, "Hey, you're an accountant, right? Stay in your lane." And I should have been like, "Yeah, I'm an accountant and the math is not math, and doctor, what, it's
Yeah.
not adding up." But I didn't do that. I continued to go to that same practitioner multiple times until it was an ER physician that said, "Don't go back to him. Do not go back to that doctor." And and he recommended another cardiologist at the time, but that's almost 6 to 7 years. And after a heart attack and after a mini stroke, before I even did that. And ultimately, my body had took such a toll that even when I had gotten the new cardiologist, I had a stroke like 3 months after that. So yeah, it's really important to challenge those assumptions and ask your doctor questions and just make sure that you are proactive when you know what's going on with your body. A lot of times doctors are busy and they
Yeah.
do see a lot of patients, and so you have to make sure that you keep a accurate record of what's going on with you, and you know your family history, and these things can be addressed, and you can talk to your doctor openly and transparency and be transparent about those things. I think once you're able to communicate with your doctor and you actually build a relationship with your doctor, you have better outcomes.
That's very huge because sometimes like you hear like the power of like a second opinion.
Yeah,
And it's kind of sad because I think like as a patient, when you find a doctor that you trust, you're like, I trust you. It's like
right.
finding a mechanic that you trust. It's like I'm gonna
Yeah,
keep coming to you. If this is what he said,
yeah.
I'm gonna come to you. Like it's okay. But then to be in a position where in some ways you're really fighting with your gut or you're having
Mhm.
to fight so much and, if you are like a patient who doesn't have like a lot of like health literacy, or if you don't have a good job where you can keep taking time off work to go to a doctor's office or afford to go to a specialist because sometimes it's not covered, those are some like roadblocks that hinder you from like listening to yourself or paying attention to it because there's like time and then there's money and then there's like understanding of like I don't really know if this is right. Do I have like doctor friends or nurses or people in
Right.
my family that I can go to and be like, this is what I'm feeling. This is what my doctor says. I don't really know if this is it. Like my gut is telling me something
Right.
else. And so there's a whole cycle of it. And it's an unfortunate experience, but I think it's more common than like
Oh,
everyone would
it's
like
a
to say.
lot more common than we talk about.
So, what advice would you give someone that was that experienced a similar situation as you or is currently experiencing a similar situation as you on how to manage the financial side of things? I know that in your case, like you were blessed with a good job and
Yeah.
you were able to manage it with everything that you had going on, but what if it's somebody else that doesn't have like a good job with
Yeah.
benefits and things like that?
Yeah. I have been in a place where I didn't have great insurance. I didn't have a great job. So I know when situations occur outside of your that happen outside of your control, there are a lot of resources out there that we don't know about or people even talk about. Uh, when I had a issue, maybe almost 20 years ago, probably like 23 years ago, I was a victim of a violent crime. And at that time, I was with the temporary service, and I didn't have any. I was with a staffing agency and didn't have any insurance. But I remember that they, immediately put me on Medicaid. They immediately got me in contact with the state and provided me so many resources that were out there. I had to apply for them, and it was a very tedious thing to do. But I remember having a bill of over like $150,000 at the time, and I was like 22 years old,
Oh my God.
that the state and Medicaid took care of, and victim assistance programs and things like that. So there are a lot of resources out there. You just have to know that the resources exist and whether you qualify for those resources. And you can find those through your hospital, you can ask your primary care physician, and you can also you can look at nonprofit organizations that exist like American Heart Association and Women's Heart and Black Heart Association that can also help you navigate through those issues. Also, sometimes we have to, which is very hard and very difficult, is to put our pride aside and ask for help. We do good GoFundMe's. We do GoFundMe's for a lot of things, and a lot of times we have to do those. We should do those GoFundMe's to ask for assistance and ask for help. You don't know what is out there or what would be offered to you until you ask.
Mhm.
So, family members and even within if you are employed, you can also look and see if through your employee resource center what options are available. A lot of times there are like grants and things like that. I know within the government, they have like grant programs where they can give you like $1,000 or $2,500.
Mhm.
Sometimes you may have to go into your retirement and pull out funds and things like that. But it's a lot better than, having the burden of medical bills beside you. And sometimes there are no options. Sometimes you don't have any options. Sometimes there are not options there. And so it's unfortunate that we live in a country where we don't have free health care, and that health care is accessible to all. And it's fair and equitable. So it is disheartening that we don't have those things. And I hope at some point in time that we can come to some collective agreement that everybody should be able to have access to health care, and because everybody deserves to live. Everybody deserves a fair shot at health. It's definitely not fair, and it's really hard to talk about because I have these conversations on a daily basis where people are in my DMs all the time asking me for different resources, different options, or even asking me if I can help, with certain expenses. And it takes a lot of it takes for you to put your pride aside to the way back to ask a complete stranger for help, because it does get to a level of desperation when you want to live and you want to feel better. You shouldn't have to. We were not designed to live in pain. We were not designed to suffer. And when you look at other and continents, and you see where healthcare is free and communities are thriving because they have free healthcare, it angers you. It angers you and it makes you upset because in one of the greatest countries
In the
in
world.
America and one of the richest and wealthiest countries, the least we could have is free healthcare.
I agree. I don't think that it's fair to have to worry about your treatments and your medical bills at the same time.
Right, absolutely.
And they always talk about like how stress weakens the immune system. So imagine like you're trying to get through a life-changing event that you can't plan for, and
Right,
then you have the stress of not just your regular bills, but then the
right.
bills of
Should I pay my
out.
copay or should I let my lights get turned off? But
Yeah,
if I don't pay my copay, then there's a chance that I'm um
Can't get treatment, you know?
can't get treatment or decreasing my quality of life because I can't afford to take care of myself because I got to decide I'm going to eat or work.
Yeah. Let's talk about Girl Be Natural to close it out. So, what is Girl Be Natural and what motivated you to start this organization?
Yeah, so Girl Be Natural is a consumer goods company started by me and my daughter, Night Era. It was started after a little between right before I had my heart attack.
Mhm.
Uh, and then up until I had my stroke. During that time, my body shifted, my hormones shifted. I started going through this thing called perimenopause. You've probably heard about it.
Yeah.
My estrogen started getting lower, and I started having a lot of weird symptoms. And I'm not, I could be transparent about this now, but it
Yeah.
was kind of embarrassing. I was having body odor that I could not explain.
Oh, wow.
And it was you like, oh my. And it was my mama who was like, girl, like what is going on? And I'm like, am I musty? Like, what? And so during that time, I also was running a nonprofit called the Pink Peppermint Project. Still have the Pink Peppermint Project, and we provide programs, resources, and services to breast cancer patients. And one of our largest programs is the Mint with Love program, where we send out care packages to patients.
Oh, okay.
And those care packages have clean, natural, carcinogen-free products to help women thrive during their journey. And so I learned how many products were damaging and unhealthy
Yeah.
for you through my friend Stacy, who passed away of metastatic breast cancer. And so she always was like, you need to use clean products. You need to stop shopping here. You need to stop shopping there. And so when I started looking for products on the shelf, there were no products that helped with perimenopause. There was nothing that talked about perimenopause, and there was nothing really natural for body odor, and especially whole body. You know, now you have a lot of deodorants now that focus on whole body deodorant, but at that time it wasn't. And what I had found in research that Black women experience perimenopause symptoms worse than any demographic.
Oh, wow.
So, and and nobody was talking about it. And so I started talking to my father, who had he was a chemical compounder. He worked for Mary Kay. He worked for
Oh,
Mary Kay,
wow.
L'Oreal, all
Yeah,
the different companies.
that's
And
amazing.
he was, yeah, it was so great. About 40 years he had been doing that. And he was trying to talk me into going to private label. He was like, if you want to do something, go to private label. And I was like, I don't want to go to private label. I want to have these natural products, and I want to be able to dictate what goes in these products and what these products are doing for your body.
Yeah.
And so I got certified as a herbalist while I was in rehabilitation from my stroke. I got certified as aromatherapist, a plant-based dietitian, all these different things. I found a website and I got all these certificates within weeks at a time. And I started formulating products in my kitchen. And
Oh,
so I came up with my first body deodorant, which we call a whole body deodorant, which we call Sweet Pits. And then we came up with a feminine wash called Sweet V. And we started putting uh containers, those products in our Mint with Love boxes. And so one of the products that the women kept asking about was the deodorant. Where did I get the deodorant? It didn't have a label on it. It was just in a box in a white deodorant container.
yeah.
I had no idea of laws and regulations. I just knew that I wanted to do something, and I knew I wanted to do something great that was going to help and benefit the human body, but also make women feel good and confident in what they were going through. And so during that time, I forgot I was having a dream before I did that. I had a dream, and in that dream, I was like real musty in my dream, and I was crying, and I was having all these issues. And God looked at me and was like, "Girl, just be natural. Just all you got to do is be natural."
Oh,
And that's how we came up with the name
okay.
Girl Be Natural. And
Wow.
so most people think it's like a hair care product, but it's a call of
Yeah.
action. It's a call of action, Girl Be Natural. And so that's how we started it. And we are still up and running. We're currently in a rebrand right now where the Girl Be Natural is going to be the slogan. And we're doing some rebranding with our name and with some of our products. And we're going to be focusing on a few hero products that people love and that have always supported us the almost 7 years that we've been around.
Wow, that's amazing. And I'm so glad that you are creating that because I feel like, not just with patients in the survivor stage of cancer, but then also like as Black women, like you hear a lot of stories about menopause and perimenopause and the challenges and trying to find products that work for you and don't. And so hearing that you're actually like creating these products that are not carcinogenic, that are healthy, that are natural, and also make you feel good and smell good is
Absolutely.
is is amazing because that is a place of like constant worry. Like what is going into my body? What am I rubbing on my body? What
Yeah,
am I ingesting in my body? Like it smells good, but is it actually healthy? Is it actually toxic and killing me?
absolutely. If you can't pronounce it, I'm like, don't use
Don't
it.
don't
Don't
use
buy
it.
it.
All
And,
right.
and and you know what? And that's so funny because most people can't pronounce ashwagandha. So I don't even like listen. I don't want to like don't you know, well, I can't say ashwagandha. Yeah. It must be bad. No, it's really good for you. And burdock root and all these things. So yeah, it's so funny.
Oh, thank you so much, Dr. ShantaQuilette, for coming back for part two. Do
Yes.
you have any closing words before we wrap up?
Yeah, I just want to emphasize about being proactive in your health and taking care of yourself. 80% of cardiovascular disease is preventable. You need to know your family history, eat right, go to the doctor, and be truly accountable in your health. When I say be the CEO of your health, I really mean that. I really mean the fundamentals and the framework of an organization, treating your body as an organization and understanding it and understanding how it works. And when there are things that are not going right, you know that you need to pivot and change to make sure your organization operates correctly and efficiently. It's just like a car. If you don't take your car to get oil changes and you don't oil changes and you don't take it for routine um, visits
Maintenance.
and maintenance and things like that, it's essentially going to break down. You
Yeah.
turn the radio up and you hear the car ticking, but the
Yeah.
car is, no matter how loud you turn the radio up, it's not going to stop the car from ticking. And eventually the car is going to stop and it's going to be inoperable. And we don't want that. And that's what we have to think about in our body. When the engine light comes on and warns us and allows us to know that something is going on, then you need to take heed in that and go to a doctor immediately and talk to someone before it gets too late. So that is always my message. Be the CEO of your health. You are your best investment. You are your only investment.
Thank you so much. It was an honor talking to you and
Absolutely.
everyone else. Looking forward to seeing you guys on the next episode.
Bye.
Bye.
Thank you.